DocTalk is brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.
Hi there, folks. Welcome to DocTalk. I'm sure glad you joined us today. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. We're going to have a great show. Dr. Matt Meisner is going to be joining us today, and we're going to talk about dehorning cattle, something that's very common practice, something that all of us have done or continue to do. Stay tuned, and I hope you enjoy the show.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. Hi there, folks. Welcome to DocTalk. Dr. Meisner, thanks for joining us.
Glad to be here again.
Folks, this is Dr. Matt Meisner, and he's a friend and colleague here at Kansas State University's College of Veterinary Medicine's Veterinary Health Center, and he is an associate clinical, you got that promotion, associate clinical professor here in our Veterinary Health Center, and he's boarded in medicine for food animals, and we're talking about dehorning.
Right.
Very common.
Something that anybody on a cattle operation has seen or probably performed. From the time you're a young whippersnapper, you see things happen. And it's one of those absolutely necessary procedures in a lot of cases to have done for various reasons. I think that first one we always think about is safety. You know, my safety, veterinary safety, producer safety, but not just the people, and we also talk about the cattle as well. So
you bet.
Their pen mates, maybe even the dog or any other horses or anything else that might be around. So other animals, anything that can get traumatized by these horns need to be gone.
And they can use those then to gore another animal, and you know, a lot of people will say that we have horns to protect our animals from predators, but there's a lot of polled cattle out there that raise good calves too.
Absolutely, yeah. Think of it as a protective part of the body, but and yes, I have seen some cattle that had horns, didn't have horns, and kind of moved down on the pecking order in the herd. But as we all know, they're plenty defensive and protective with a lot of other appendages of their body too. So it's not necessarily absolutely needed to protect calves.
So safety and handling are one, but let's. What about economically?
Well, economically, we talk about the trauma that you would think you'd see, but bruising, bruising in carcasses, and just bumping up against each other on those kind of things could lead to trim and extra different things that would happen to the carcass that it's slaughtered.
I've actually seen some of the reports saying that shipping animals to slaughter with horns versus polled, that we can have anywhere from 0.2 to 2 pounds of trim.
Right.
So could be significant from bruising. What about sometimes, I see some of the horns will grow around and grow into the skull. Can those be an issue for the animal?
Yes, they continue to grow. They don't stop just because they hit skin and hide. And they just continue to dig into skin and whatnot, and we have to remove them. And sometimes they just grow abnormally. So that's a possibility. And then even just the facilities to handle them. So we have to remove those so they don't knock them off, going through chutes, alleyways, those kind of systems.
Right.
So safety for the animals.
So, and then of course the last one was the surgical, or what some people term the cosmetic dehorning.
Yeah, sometimes we talk about cosmesis, but I do it more oftentimes to close skin to prevent flies infection from setting in. So we remove the horn and then close it back across. And so yes, it seems cosmetic, but has a function too.
Cool. Well, I think those are some great, kind of leads us off, gets us started on why we do it. When we come back from the break, we're going to talk a little bit more about what different types of techniques there are for horn removal on cattle and how we do it without causing a lot of pain. Thanks for joining us. We'll be back after the break.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Meet the Veterinarian, brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Dr. Randall Spare is president of Ashland Veterinary Clinic, the largest veterinary practice in southwest Kansas. He focuses on bovine care, especially cow-calf production, and at AABP in 2013, he received the award for developing an outstanding preventative medicine program for beef production. A graduate of K-State School of Veterinary Medicine, Dr. Spare and his wife Michelle have 5 children.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hi there, folks. Welcome back to DocTalk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and we're tickled that you joined us today. I'm joined by Dr. Matt Meisner, who's a veterinarian and boarded in internal medicine. He's an associate clinical professor working here in our veterinary health center, and we're talking about dehorning cattle. And when we left for break, we were talking about different reasons, and I think a lot of people know why we dehorn these animals, but now let's get into kind of the meat of the situation here and talk about the different techniques that we're going to use.
Right. I think first and foremost we want to make it as quick and efficient as possible, and probably the most efficient and quick and easiest way to do it would be to take the horns off before they become mature, and that'd be a disbudding type procedure.
So that's while they're still, when they're young, and you grab the horns and they're still moving with the skin, they haven't secured down to the skull.
Sure, yeah, it's almost a little smooth, leathery button on a lot of calves, and we can take those off just by damaging what makes the horn before the bone grows, and we can do it with things like dehorning irons, which get hot, and burn around that bud. There's some pastes, they're kind of caustic that you put on that destroy that area of horn, and little gouges and various methods to remove that bud quick, easy, off before it has a chance to mature. Oftentimes bleeding is minimal, if any, and quick.
How, when you're looking at that keratinized tissue, how far out around from that horn do you need to get? Oh,
a small bud, we're getting out. It's nice to be a quarter inch outside that bud, kind of hard to see it. There's kind of sort of a little raised bump, but you want to be outside of that area.
Then let's move into some of the different things that you're going to do. Once that horn's attached to the skull, and now we have horn development, we're moving into different types of techniques.
Yeah. Same thing goes. We still have to get outside what's making the horn, and what it actually is a piece of bone covered by horn, and so it's following that bone up, and we have to get that tissue that makes the horn. And there's several ways we can do that. We've got probably the most common one would be a gouge or a Barnes type dehorner, which the horn fits within it. We open the handle and we crush and take the horn, skin, and bud off that way. We have various types of dehorners that will chop, trim, guillotine types.
Yeah,
dehorners.
keystone.
The keystone type, really large horns. We've got those.
And now we probably need to back up a little bit, because this is dehorning. This is taking the horn clear off and getting the keratinized tissue, getting a margin around that horn, and taking the whole thing.
Right. Bone, horn, everything around the outside comes off with it. So yeah, that's a dehorning method. And the other one, which we showed about, we had wires. We can use OB wire or wire saws to cut those off. And those are nice to get really hot and actually cauterize as we go through. Any of these dehorning methods will have some bleeding, and we can use these burners or different ways to could it to cauterize those vessels. But those are big dehorning, taking the entire thing off to the base. Then we have the tipping methods, where basically you're taking the end of the horn, where we're going to leave part of it, we're not going to take it to the base. Safer, less bleeding.
Well, when we look at many of these different methods, different ages, different animals, some complications can occur. So when we come back from the break, let's talk a little bit about some of those complications, and we'll return right after the break.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. Today we want to give your BQA Tip of the Day on bedding, which gives us good cattle comfort, animal welfare, as well as insulation, whether it be in the wintertime or in the summertime. In a dry lot situation, whether it's in a feed yard or a cow-calf situation, stocker, whatever it may be, we may be on a dry lot situation. We want to give them adequate bedding to give them good cattle comfort, as well as insulation to prevent heat stress, as well as cold stress in the summertime or the wintertime. It's extremely important that we give them all the comfort we can give them, produce a safe product. We also want to work very hard at managing this bedding. Bedding can get dirty, as you know. We need to get in, scrape it, clean it, put out new fresh bedding as needed to provide a clean source and a healthy environment.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
In the springtime, cattlemen need to be thinking of preventing important diseases like pink eye. Pink eye prevention includes management factors like good fly control, pasture management, along with a good vaccination program. Eyesight from AgriLabs has broad efficacy coverage as its origin from 8 different field isolates of Moraxella bovis. It is safe, smooth, highly syringeable, safe with young calves and pregnant cows, and provides superior protection against pink eye.
TrueTest Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hi there folks, welcome back to DocTalk. I'm here with Dr. Matt Miesner. He's a veterinarian and he's also a boarded internal medicine specialist, and we are talking about dehorning cattle. And when we dehorn, when we left, we were talking about tipping. And I think we'd backtrack just a little bit to kind of clarify the difference between dehorning and tipping.
Yeah, tippings, oftentimes you'll see that with a lot of rodeo bulls, rough stock. Those is probably the most common place people had seen that, where you don't take the entire horn, you just take the tip or portion back to, silver dollar size blunted area. So you're blunting the horns.
And so this is the insensitive part. It's kind of like clipping your fingernails, the way I'd describe it. You're just trying to round that horn off so it's not pointed. They can't use it as a weapon, but...
And there's a little sensation there.
But
There's little sensation, but very minimal. But there's still some blood vessels, so you don't want to go too far. That would lead to some of the complications that we can talk about as well. So, disbudding, dehorning, tipping, and then it's not always a benign procedure. It's a necessary, but we have to take some precautions.
And I have seen some things in feedlot facilities where, most people do a great job of tipping, but the one thing that just kind of gets to me is when we tip that horn, when we decide that tipping is going about halfway between the base of the horn and the tip, and we're cutting through skull, bone, very vascular area.
Yeah.
Might as well have just taken the whole thing off.
Absolutely.
If you're going to do that.
Yeah,
So-
and not just bone, blood, and whatnot, but now you're actually within the sinus cavity. Occasionally that horn will be hollow out that far.
Absolutely. So, it kind of leads us to a spot, and I think that it's one of those that's a sensitive area. It's one of those that we deal with on a day-to-day basis when we're talking about dehorning, and that's pain control and making sure that these are painless procedures. And what are some I know that we can't make all procedures painless, okay? And sometimes our unintended consequences of making something painless can create more pain by running the animals through the chute more times, increase the anxiety and stress. But when we're going to do some of these big dehorns,
Right.
what are some of the things you recommend?
Big dehorn, it's becoming standard of care in some of those situations. You're right. You're going to house them and group them, they can get traumatized. But we're going to numb it, the horn, so that we can do a good, safe job. Handling is quick anytime we can. Small numbers, large horns. I'm going to take the time, it doesn't take hardly at all, to numb the nerves that supply that horn. And they resist less, so you have less trauma in the chute. It's less painful. So it's one of those things that, all in all, less stress, less pain, less of a big to-do to get it done. And I think that standards of care are going to require us to do that.
Yep, work with a local veterinarian and get your, either get the product or have the veterinarian come out and do those big dehorns.
Yep.
Well, I think it's important, and I think when we come back, we're going to have one more segment, but let's come back and talk about some of the problems that can go on, how we solve those, and then how we can move forward to prevent them. Thanks for being here. Thank you for watching us. We'll be back with more Doc Talk right after the break.
It must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones, all they want to do is go to the barn, swing a rope, and be a cowboy. It's something, it's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
American innovation is being driven in places you might not expect by people like Brent Hayek, an Oklahoma family farmer, who recently set a world land speed record in a Ford Super Duty pickup truck powered by renewable B20 biodiesel. Advanced performance is here, now, putting America on the fast track to more jobs and energy independence. Biodiesel, America's advanced biofuel.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, folks. Welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Meisner. We are both from Kansas State University's College of Veterinary Medicine, and Matt is associate clinical professor, works in our referral clinic, and also does some haul-in ambulatory work here at Kansas State University's Veterinary Health Center on mini cattle, and we're talking about dehorning. We've gone through the whys, the hows, the pain-free, and now let's get to some of the problems that can occur.
Well, first and foremost, we always think of hemorrhage or severe bleeding, and there's no doubt about it. You don't wear your nice clothes a lot of times when you're doing these kind of procedures, and so there's a lot of bleeding, and we're going to take every precaution we can to control it, whether that's actually find the vessels and twist those down, or use some powders to help a clot form, or heat, hot irons can cauterize it.
Yep.
So bleeding would be far and above the immediate thing that we're going to do. So we could prevent that by doing them early on, very little bleeding, or we just take some precautions to take care of it at the time.
And I think that's the key. If you're going to dehorn, do it as early as possible.
Right. Yeah, quick.
I think people would be amazed to know that 50% of the dairy cows are born with horns.
Right.
But you never see a horn in the parlor.
No.
And they take care of them as babies.
So, we do that on a routine basis at the dairies, so take care of them.
All right, back to the issues, but one of them that we see too is flies, right?
Right. So after we take care of the horn, we're going to have an open wound that's going to have to take time to heal. And flies laying eggs lead to maggots, and so fly control, repellents, those kind of things to prevent infection that way. The wound itself can get infected, but I think flies are a big hindrance, and so that's the situation where we might go back to a surgical dehorn, where we can remove the horn and then take the skin and suture it back across the wound. A lot less likely to get infected, or flies.
And I think that flies carry a lot of different bacteria that people don't realize, E. coli, salmonella, and probably some of our pathogens that'll set up some of these infections of the wounds.
Sure. Yeah.
About the sinusitis, and I think this is the one that kind of, when you're opening up that sinus with a dehorn, we can have some issues here.
Sure, and it's an ascending, so now we're getting even deeper than just a superficial wound. It seals over. That hollow horn or those vessels travel right into the front part of that forehead of that bovine, and can set up an infection. Sinusitis sets in, headache, and then we have just a pus-filled sinus, and really difficult to treat. You can see some discharge from the nose occasionally, but you'll see them occasionally head pressing in a wall or a fence, just like you would with a sinus headache, and hard to treat. We try to get that drained, but we try to prevent that by getting good drainage, antibiotics, and wound care early on.
Yeah, clean equipment and work with your veterinarian.
Right.
Thanks for being here today.
Glad to be here. Fun time.
Did a great job. Folks, remember, always work with your local veterinarian. And if you want to know more about what we do on Doc Talk, you can find us at DocTalkTV.com. Thanks to Dr. Meisner for joining us here today. Lots of things to know about dehorning. Work with your local veterinarian. Thanks for watching Doc Talk today. I'm Dr. Dan Thompson, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.